Day in, day out, we hear people coming down with stroke, even younger adults. So what is stroke and what can you do to prevent it? I welcome you all to another episode of Your Health Matters. Amina Tadeyemo is my name, and today I'll be discussing what stroke is and how can you prevent it. A stroke occurs when something blocks the blood supply to a part of the brain, or it could be when a blood vessel in the brain is leaking or it bursts totally. In either case, a part of the brain is damaged or is dead. Now, you need to know that, like every other organ in your body, your brain needs oxygen to function properly. And this oxygen is a content of your blood, carried by the blood vessels and mainly the arteries. So if something is blocking these arteries, depriving the brain cells of oxygen, the brain cells could die within minutes. So this is what causes a stroke. Now, there are different kinds of stroke depending on the cause. The first one is what we call ischemic stroke. Don't worry about the terminologies, it's a medical term. But it means that fatty deposits are blocking the arteries, depriving them of oxygen, depriving the brain cells of oxygen because there are fatty substances blocking the blood vessel. So that brain cell or cells can die within minutes, within a very short period of time. The second type is hemorrhagic, and that occurs when there is an artery in the brain and that artery is leaking blood or is even ruptured. And why would this happen? Usually this might be as a result of an uncontrolled high blood pressure, uncontrolled hypertension, or another medical condition that we call aneurysm. That is, there is a bulge, a part of the artery is bulging, or there is an abnormal swelling of the wall of the artery. What is most important is the high blood pressure, uncontrolled high blood pressure. So let's move on. So how can you recognize that this is stroke? One, there may be a sudden numbness or weakness in the face, the arm, or the leg, usually on either side of the body. There may be sudden confusion or trouble speaking. There may be inability to see that happens suddenly, or blurring of the vision in one or both of the eyes. The individual might be unable to walk, and there may be a sudden severe headache. So if you notice that someone that you are with is going to have stroke, what are those things? What should you do at that moment? Number one is for you to act fast. We will always say that you should act fast. So how do you act fast? One, ask the individual to smile. When you ask the individual to smile, does one side of the face droops to the other side? The second thing is ask the person to raise both arms. Does one arm drift downwards? And thirdly, ask the individual to repeat a simple phrase. What is your name? Is the speech slurred or strange? And lastly is the time. Time is art. The art is time. Time is of importance in stroke, in the outcome of the stroke. So if you observe any of these signs, ensure the person, the individual, is transferred to the hospital immediately. Do not waste time at all. So now you know what stroke is and the likely causes. So what can you do to prevent stroke? Join me on the next episode where I'll be discussing what you can do to prevent stroke. I thank you for watching this episode, and I want you to stay safe and healthy. Remember that your health matters always, and staying healthy is easier than getting well. Again, Aminat Adeyemo is my name. Join me on the second part of this episode. Bye.